So this is an important part now when it comes to stroke, the thrombogenicity. So, and distinguishing different kinds of thrombogenicity. So it is cardiac thrombogenicity, vascular thrombogenicity, or systemic thrombogenicity. So that's really the triad of things. And when it comes to biomarkers, I think that we could monitor in different ways to try to capture this thrombogenicity. And the term we wanted to introduce now is this cardiac thrombogenicity, because that's something very relevant when it comes to this coupling between the heart and stroke. So it's difficult to predict really to predict the stroke risk is one thing, but predicting also the different stroke types. Would this be atherothrombotic stroke, part of cerebrovascular disease, or the cardioembolic stroke? And coming to this thrombogenicity, the aim is really to try to distinguish these parts and to monitor how to predict, and also in the long run how to prevent those parts. And a lot is known about the prevention of atherosclerosis and the atherothrombotic part, and this is known on the cardioembolic. And that is why this concept of the cardiac thrombogenicity is very important. And then when it comes to biomarkers, of course, there could be biomarkers measured in blood, but also echocardiography biomarkers. So looking on especially left atrial mechanics. So we're interested in left atrial strain as one potential risk factor for this cardiac thrombogenicity. And monitoring the left atrial strain with echocardiography has a predictive value in observational studies. And it could also be seen as somewhere a pre-stage before atrial fibrillation, so decreased left atrial mechanics, even in the absence of detected atrial fibrillation, for example. One promising thing is also on inflammation, because inflammation is a risk factor, but it's also difficult because inflammation is also a risk factor for atherosclerosis and atherothrombosis. So distinguishing the inflammatory component in thrombogenicity and atherothrombosis, so in the vascular thrombogenicity versus the cardiac thrombogenicity. The classical inflammatory biomarkers do not differ between these two origins. So more specifically looking on immunothrombosis, there are some studies that for the neutrophil platelet aggregates and markers of that, for the neutrophil extracellular traps, NET, that have been shown to be different between the cardioembolic and the atherothrombotic stroke. But still, these are observational studies and still part of this research area. So we're interested in different ways of intervening with this inflammation. And one of the things which is interesting is omega-3 fatty acids, for example. So there are trials ongoing for secondary prevention of using omega-3 fatty acids, and looking at the different trials, the results are very different. And as a cardiologist, I'm mainly interested in the preventive effects of myocardial infarction. But when we look on stroke, there's one important part in these trials is that there is a certain number of studies that have shown an association with increased incident atrial fibrillation, but still no effect on stroke outcome. So this implies that the stroke risk associated with atrial fibrillation may be neutralized through the omega-3 fatty acids. But this is also an area of research, but something which is worth looking further into.